These are my favorite ways to do myofascial release for back pain and sciatica. First, you need to know you're not literally releasing knots or adhesions. That is an outdated myth. It does provide short-term pain relief, short-term improvements in range of motion, and my personal favorite, relaxation and stress relief. One of the most valid reasons to use myofascial release is to release stress and fear. So what kind of tool should you use? A foam roller, a ball, a massage gun, or maybe scraping like gua sha or cupping? Well, the truth is it makes zero difference. It's only based on personal preference. If you like one versus the other, do that. Because remember, adhesions and breaking up scar tissue, that's a made-up thing. So let me show you my favorite ways to release some tension in the areas that are bothering you. First, I like to grab some type of ball because it's more easy to precisely find your sore spots. I do not recommend a lacrosse ball. They're really hard and kind of unforgiving. I like something squishy. This is actually like a play, like a bouncy ball. It's softer than a tennis ball, but you could use a tennis ball as well. Please note, more pain does not equal more therapeutic benefit. In fact, if you're in so much pain that you're tensing up because of the self-massage, you're having the opposite of the intended effect, which is to relax. Many of you have glute pain, so first we're going to hit the glute. Find a seated position, find a soft ball, find the sore spot in the glutes, wherever it might be. It could be anywhere. Find your sore spots, lean away from the ball, take a breath, and as you exhale, you can just lean towards the ball. And that might be enough. I'm not even putting 50% of my weight on the ball. I'm barely leaning on it, and I can support myself with my hands. If I want more pressure, I can shift my weight towards the ball. If I wanted a lot of pressure, I could put all of my weight on the ball. But I'm noticing that as I do this, I have a tendency now that I'm kind of wanting to tighten up, which means we are causing the body to have a fight or flight response, which is the opposite of what we want. So we only want as much stimulation or sensation as we can handle while taking peaceful breaths. So if I find a sore spot, you might kind of roll around until you find a really nice spot. Oh, like right there feels really nice. So I'm just going to take a breath and relax into it. And I'm not going to go anywhere until I feel like I'm truly relaxing. Once I feel like I'm relaxing, I have the option to also do what we would do in a clinic, which is like a pin and stretch type of technique where you can extend the leg and then bring the knee to the chest. So we're just stretching and shortening that glute muscle under the pressure of the ball, which mimics, hey, we're trying to get pain relief while we're exploring a motion, so that when we eventually try to perform this motion without the self-massage, maybe that exercise that was painful before might not feel as painful afterwards. The next spot is gluteus medius. You just follow the glutes around to the side, or you can find your hip crest and go slightly under that. If you're wearing a belt, it might actually be kind of where your belt is. So I have to pull my belt up out of the way, and this is where the ball is going. It should feel squishy. And then lean on it, and you can either just kind of roll a little bit, and we're trying to breathe, and you can do this cross-frictional type of massage, or you could make a pillow with your arm, and you can put all your pressure and just roll. The angle of the pelvis is going to determine how much pressure you have. Remember, if it's too much pressure and you feel like you want to tighten up, then that is too much, so back off. You should only put as much pressure as you can while still being able to take deep, peaceful breaths, okay? And then relax. Now, stage 2 is if you wanted, you could even move the knee back and forth as you're doing this, as you're pinning the muscle down, taking deep breaths with the movement. So you could inhale as you straighten the leg, exhale, bring the knee to the chest, okay? And feel free to reverse the breathing, whatever feels most natural to you. The point is to give you a relaxing experience. Location number 3, the low back. Might be the quadratus lumborum, or the multifidi, or the latissimus dorsi. The truth is you're hitting all of these muscles when you're in this area, so don't worry about it. Just hit a spot that feels good. Find the center of your spine, move off to the side a little bit, and anywhere in this territory that feels sore is fair game. So find a spot you like. Lay down, place the ball under that spot, and then pull the same side knee towards the chest. You could just grab the knee with your hands. If you can't reach, you can use a strap to hold the knee so that you can feel relaxed. You don't want to feel like you're using effort to hold yourself. You want to be able to just relax. So I could even make a loop with my hands around a strap, and then just move the knee gently forward and back, or even side to side. Meanwhile, I'm taking deep, peaceful breaths, trying my best to release tension and stress from my body and mind. Personally, I like to inhale, lengthen the leg, exhale, pull the knee up towards the chest. Inhale, lengthen. I'm using my arms for this so that my hips and low back can relax. Exhale, pull the knee towards the chest. Really just trying to relax. Remember, use a soft ball. Breathe peacefully and slowly. Prove to yourself you can relax. And remember, we're not breaking up scar tissue or adhesions. We're allowing short-term pain relief, increased range of motion, and relaxation. When we're in chronic pain, our body is tense. We're overprotective. We need to get past that overprotective barrier to overcome fear, to become more active, to get stronger, to get out of chronic pain. Just remember, myofascial release is a tool to help you get through the day, but the long-term strategy requires lifestyle change. And remember, we have a free masterclass if you'd like to see a deep dive and really see how to put the pieces together and overcome chronic pain. Watch the masterclass. The link is always in the description of our videos. I'll see you in the next one.